Welcome to Zoom In, Zoom Out, your global look at news from Taiwan. I'm Tiffany Wong. Taiwan is a super-aging society with elders from all walks of life seeking care, but many feeling left secluded. For Indigenous elders, this feeling of seclusion may not only be based on living in more remote areas of Taiwan, but it could also be a seclusion from participation in policy discussions. Today, to discuss improvements to elderly care practices in Indigenous communities, we're joined by an assistant professor at National Dong Hwa University, Wasiq Silan. Wasiq has spent nearly a decade researching elderly care practices in Indigenous communities. Wasiq, welcome to the show.
It's great to be here. Thank you.
So could you explain what does indigeneity mean?
Indigeneity has been used as a term to divide us and them. So just to put it in a very broad way, in the UN, which I participated in the past 7-8 years, we have been building this like a pan-indigeneity. So we indigenous people, we are fighting for the climate justice. We having like this shared like land-based practices. And you, the colonizers, you didn't understand. So we have been like building this like we indigenous and you non-indigenous. But it's a very simplified way of seeing indigeneity, like in different contexts. For example, in Taiwan, we have different categories to put that into law. And in Asia areas, there are different countries have different contexts and histories to understand indigeneity. Like, for example, in Philippines, your religion actually plays a big part in whether you are recognized as indigenous. And like globally, it is like way very different. Like in the Nordic countries, like for the Sami people, you have to speak the language in order to be recognized as indigenous. Like one of your grandparents needs to be a Sami speaker. So that's not the same in Taiwan. In Taiwan, we're mostly based on your blood. So I think like to bring indigeneity into question, like to problematize indigeneity is a very important thing, and not just take it as a category, like, oh, okay, state recognize me, so that's no problem. But then I was also like hoping to tell my students that you need to really rethink what does indigeneity mean. It's not just a set of click boxes that you have to fulfill, but it's about how you live out this indigeneity, like indigeneity as a emergence, as fluid, as something that you tell your stories about, of how your identity is something that's alive. So it's a verb instead of a noun.
So much of your research has focused on the Tayal group, which is just one of many Indigenous groups in Taiwan. What have you seen in your research there?
So I have been focusing a lot on the Tayal people because my grandmother spoke Tayal language and then were cultivated in the Tayal village. So this is something that I feel that I have the relational accountability that I can speak to. But throughout this decade of doing research, I realized that it's not that we're doing pan-indigenizing all these concepts, but you can really see that there's shared challenges and shared solidarities in these aspects. So the collective care, it looks different in different contexts, from the Arctic coast to the Taiwanese mountain area. And in my village, I see that not as a pure and authentic thing, but it's more about a hybridity that has been influenced throughout different ways of colonization. So in my village, we are very close to the Taipei city. So we have like KMT people coming in and then like having a hot spring and having a good time. And also Vietnamese War era, there were American soldiers coming into our village and just having a good time during their holidays. So with these waves of tourism and this background info, like the background influences, I find out that there's no pure collective care that I see, but it's more about doing things together.
And when do you think the government started to be aware of, needing special, culturally sensitive care in Indigenous communities for their elders? Yeah.
And I think it was starting when the martial law was lifted towards the 80s, end of 80s, and then the citizenry is getting alive, and it is starting to be okay that you can be Taiwanese or you can be part of a group but not exactly the same as the national narrative. So it was the time when there are people called like indigenous movements. So then there were like concepts of indigenous peoples and more people speaking up to talk about we need to be called the right way, not the savages or not the barbarians, but the indigenous people, and from indigenous people to indigenous peoples. And also, we want to have our own traditional territory being recognized and into the legal framework. So I think it was like a very long struggle. And then also recently we had the Act for Indigenous Health being passed, and cultural safety has been made into that act. So it is still yet to be done what that means, but at least we started to see that indigenous sovereignties or subjectivity, 主体性, being recognized into the national framework. But we still need to really observe what that means with all these political things happening.
So there is sort of a call for indigenous perspectives in policy right now. How do you think that's been implemented so far? And
so what we have seen so far in like language revitalization or identity reclamation among indigenous people, indigenous youth, is that there's a lot of money being put into these individual policies, but the way it has been done has been mainly state-centric. So it's very like neoliberal, and it has been emphasizing on these metrics rather than the relational and more indigenous-led approach. So yes, there were a lot of policies being done and being designed and implemented, but then we have very little results. And one of the research that I have been doing with my colleagues is that we wanted to argue that it is because the absence of the relational and indigenous way of seeing the world has been completely or very much to a large extent ignored in the whole process.
And how do we get to address that gap?
So we have been thinking about how in light of this. So actually the conference that we're having right now, so which we entitled From Oppression to Decolonization and Reclaiming Indigenous Sovereignty, is all about having a more shared understanding among frontline helping professionals. Only by knowing that we are not alone in this whole structure can we have a consolidated voice. So it is very easy for the policies to divide us, and then we started to ask ourselves, like, it's my individual problem. I cannot do this administrative form. I cannot do the reimbursement and say in a nice way that my superior will understand. But this is a shared struggle caused by the power imbalance and also the structure that has permeated this coloniality that Taiwan is still very hesitant to confront.
And what other sort of concepts do you think need to be included in indigenous healthcare policy right now? How can the government pay better attention to the actual needs of indigenous people?
Yes, so this is also something we have been working on, and I think one key phase would be indigenous-led. So in Taiwan, we're still very much paying attention on representation. So we see like, oh, this is a group of Dayan, so we pick one of the person, usually it's middle-aged men. And then the other groups that, oh, they're Amis and Bansa, oh, we put another one. So it's usually a higher class, more like heterosexual men. So in different groups that they pick like one person as representing the group, but then it doesn't really address this whole picture of power imbalance and structural oppression. So I think indigenous-led is one of the key things that we need to address in a way that when we're designing policies, indigenous peoples, not just one representative to be on the table, but like to have a meaningful dialogue with the communities and about the communities, so not deciding for the communities. And another thing that I think I wanted to emphasize is also the United Nations Declaration on the Rights of Indigenous Peoples. So for Taiwanese indigenous peoples, we have this basic law, 原基法. But then it has been very much still like put into somewhere the like dark corner in the room, and nobody really know like what it means, or it's not very much implemented. And it has been linked to the UN DRIP. So I feel that it would be really important to have this education and this dialogue that we're actually in a shared structure with all these other indigenous communities that has been like struggling to advance our human rights situation, and the UN DRIP should be the minimum standard of what we are standing at.
We did want to talk sort of about, indigenous elderly communities specifically. and the policies that are there to address them, but also who is there to help people, Indigenous elderly people, help them get the care that they need. So of course there's work that's done in Indigenous circles for that. How do we get younger generations of people to pay attention to this issue and also help out elderly communities?
Many of the young people, they're going to be in this profession, so being helping professionals in the front line. And what I'm worrying is not so much about not enough people in this profession, but how are you prepared and equipped to be in a good position to speak for the elders and then speak for what they need instead of your superiors telling you and measured by the metrics that's imposed by the majority group. So I think education is very important, and also this kind of dialogue space, this platform, conference, it would be very important. And also showing our faces in front of the camera, and then more people would get to know Indigenous social work would be important, and it playing a very important part in the Indigenous development would be very important. So all these factors combined would be very crucial to lay down foundational work for getting more young people being involved in the elderly care.
And like you said, with events like the conference here today, what sort of discussions are you seeing? What's standing out to you in terms of the future of this social work?
So for me, I feel very humbled to be able to be present at the conference. So in our department, we have two lines. So one is on social work, another is on Indigenous development. So Indigenous development is more broad, and social work is very much on social work profession. And for me, as a semi-outside, inside, outsider in the group, is that I feel super humbled to witness this transformation of these frontline social workers to be able to talk about their experiences, many for the first time, in front of people, of what my work has been troubling me, and I feel that I don't know how to deal with these emotions because the social work profession has obligated me to leave, but I feel that I have these relational accountabilities to stay. As a social worker, it's not individual. You see all these people sitting in this room, and many people feel the same. So it is the context that has been very much embedded in the welfare colonization, and also how this Han Chinese-driven system has been forcing you to feel this way. So this effective way could be a starting point for decolonization.
Okay, so it's also about creating solidarity between social workers and the causes that you guys are working for, that.
Yeah, and it's not just for social workers, because many people, they don't necessarily get a social work degree, but then people who care about Indigenous community-based work and Indigenous development in a broader sense. So thinking about Indigenous sovereignty, I think that's something that we're hoping to gather.
At this conference, there's not just people from Taiwan, but also people from other countries. So could you talk a little bit about that?
Yeah, so this time we're very privileged to get the guests from the US and Canada. So it was a very good moment, and I think for many of the participants in the conference, it's a very validating moment to see that, what we are doing is not just us, but also in Canada and in the US, there are similar challenges in terms of representation or lack of Indigenous recognition, and also different pedagogy or different ways to move forward, such as photo voice or different digital storytelling techniques. So I think it's a great way to involve more people working in the area of social work, not necessarily social workers, but working and interested in developing Indigenous development. So it's great to have them here, and then we really look forward to further collaborations and then getting more people involved and interested in Indigenous communities.
Thank you so much, Wasiq. It was great to have you on our show today.
Thank you so much.
This was Zoom In, Zoom Out. For more stories from Taiwan Plus News, you can follow us on our social media or our website. Thank you for joining us, and we'll see you next time.